Blood glucose monitoring is an essential part of managing your child's diabetes. It is important for you to check your child's blood glucose often to determine how much insulin your child's body needs. Your child's nurse will teach you how to use a glucometer to test your child's blood glucose. You will need to check your child's glucose level 4 to 6 times per day, usually at the following times: every morning when your child wakes up, which is called the fasting blood glucose; before all meals and snacks, or at mealtimes, even if your child is skipping a meal; before bedtime; before and after exercise, and depending on the activity, you may need to check your child's glucose level while he or she is exercising. In addition, you should check your child's blood glucose if you think that it may be too high or too low. We also recommend that you check your child's glucose at 2 in the morning for the first several days after being discharged from the hospital until your child's provider instructs you to stop. If your child's insulin dose changes, you will also need to check his or her glucose level at 2 a.m. Your child's blood glucose will naturally rise after eating, so we do not recommend testing blood glucose in the 2 hours after meals unless your child has symptoms or is planning to exercise. Your healthcare provider may recommend additional times you should check your child's blood glucose level. According to the American Diabetes Association, a normal fasting blood glucose level is less than 100 milligrams per deciliter, and 2 hours after a meal, the blood glucose should be less than 140 milligrams per deciliter. The International Society for Pediatric and Adolescent Diabetes recommends a target glucose range of 70 to 180 milligrams per deciliter. If a child is wearing a continuous glucose monitor, it is recommended that the child's glucose be in the target range at least 70% of the time. Having a blood glucose that frequently stays above or below the target range makes your child more at risk for diabetes-related problems. Keeping your child's blood glucose level close to his or her target range decreases the risk of long-term complications from diabetes. To help assess your child's blood glucose control, your child will have a blood test completed every 3 months at their office visits. This test is called hemoglobin A1C. It measures your child's average blood glucose over approximately a 3-month period. Most children and adolescents have an A1C goal of less than 7%. Your child's goal, though, may be different, and so your provider will discuss your child's individual goal with you. Testing your child's blood glucose and recording the values for your healthcare team gives them an accurate picture of your child's diabetes and whether medication adjustments are needed. Here are the steps for checking your child's blood glucose. Step 1. Gather supplies: glucometer, alcohol wipes, test strips, lancing devices, and lancets. Wash your hands and your child's hands with warm water and soap. It is important to have clean hands to obtain the most accurate blood glucose reading and to decrease any risk of infection. Warm water will also increase the blood flow in your child's hands for easier testing. Step 2. Insert the strip in the glucometer. The glucometer will display a drop icon to show it is ready to test the blood glucose. Step 3. Select a finger and use a lancet to obtain a blood sample from the side of the finger. Always wipe away the first drop of blood and use the second drop of blood for testing. The most common mistake in blood glucose testing is using too little blood. Make sure you obtain a sample that is large enough to give you an accurate reading. Keep your child's hand low to help improve blood flow to that finger. If your child tends to pull away, hold his or her hand on a flat surface. Step 4. Draw blood into the test strip. If needed, Gently squeeze the finger to obtain the blood sample. Place the end of the test strip against the side of the blood sample. The test strip will draw in the blood and beep once it begins testing. Step 5. Keep a written record, your blood glucose log, even if your child's glucometer has a memory. Record the time, blood glucose level, number of carbs eaten, and insulin dose administered. Bring your child's log and all glucometers, including the one your child uses at school, to every diabetes clinic appointment. Your nurse will show you how to test your child's blood glucose before being discharged. We encourage you to practice often so you are comfortable by the time you are discharged from the hospital. Another option available for monitoring your glucose if you use rapid-acting insulin is a continuous glucose monitor, CGM. It's a small sensor that you wear on your body that continuously reads your glucose levels and lets you know which direction your glucose is going. CGMs can be used as a replacement for testing your blood glucose with a glucometer most of the time. The device transmits glucose readings to a display device or to an app on your smartphone. It can alert you to low and high blood glucose levels. Ask your doctor if you would like to learn more about getting a CGM. When you first receive your CGM, your diabetes team will help you set it up with the correct alert settings and can help you learn whether you can use it with your phone to view your blood glucose values. Please do not set up the device without talking to your diabetes team first. In the next video, we will talk about the different types of insulin.